Spine range of motion, cervical side bending, goniometer. Have partner sit with head in neutral position and center of rotation on the spinous process of C7 vertebrae. The stationary arm should be perpendicular to the floor. The mobile arm should be aligned with the occipital protuberance of the skull. Normal range of motion for this joint is 45 degrees. Joseph received a 45-degree measurement. Range of motion for hip external rotation. The partner should be sitting with their legs bent and dangling off the side of the mat table. Instruct your partner to move medially. The axis of rotation should be the anterior patella. The stationary arm is perpendicular to the floor. The mobile arm alignment is with the anterior crest of the tibia. Normal range of motion is 45 degrees. Joseph received a 45-degree measurement. Range of motion for shoulder external rotation. Have your partner lie supine with their shoulder abducted to 90 degrees and their elbow flexed to 90 degrees, keeping normal pronation and supination placed. Place a towel or face cradle beneath the humerus so the humerus is level with the acromion and arm is supported. The axis of rotation should be on the olecranon process, and the stationary arm is on an imaginary perpendicular line to the floor. The mobile arm should be down the ulna aligned with the ulnar styloid process. Normal range of motion for this action is 90 degrees. Joseph received a 90 degrees range of motion. Wrist manual muscle testing, Flexor Digitorum Superficialis. Have partners sit with their forearms supinated and supported on the mat table. With one hand, hold down all of the digits except the finger being tested. Instruct your partner to bend their fingers at the PIP joint, keeping the DIP joint straight. Use other hand to resist the middle phalanx into extension and perform this individually for each digit. The plane of motion is sagittal. The origin is the medial epicondyle of the humerus. The insertion is the middle phalanx, digits 2 through 5. The action is the MCP and PIP joint flexion of digits 2 through 5, and it assists with wrist flexion. Joseph received a 5 on the manual muscle testing grade. Manual muscle testing of the Quadratus lumborum. Have partner lie supine on their back, holding the edge of the table with both hands. Grasp one leg proximal to the ankle joint and have their partner hike their pelvis toward the ribs. Pull down on their leg. The plane of motion for this action is frontal. The origin is the iliolumbar ligament and the iliac crest. The insertion is the lower border of the 12th ribs and transverse processes of upper lumbar vertebrae. The action depresses the rib cage and laterally flexes the trunk. Joseph received a 5 on the manual muscle testing grade. Hip manual muscle testing, the Gluteus Maximus. The partner should lie on their stomach and bend their knee to 90 degrees of flexion. Instruct your partner to lift their thigh off the mat table and place one hand proximal to the knee joint and distal to the thigh. Apply resistance in a downward direction. The plane of motion is sagittal. The origin of the Gluteus Maximus is the sacrum, coccyx, and posterior crest of the ilium. The insertion is the gluteal tuberosity and iliotibial tract. The action is hip extension and hip external rotation. Joseph received a 5 on the manual muscle testing grade.